Hello, and welcome to the second of three webinars in the Informed Supply Chain series. My name is Jeff Cohen. I'm the Chief Strategy and Innovation Officer at Informs, the largest association for the decision and data sciences. Informs members support organizations and governments at all levels as they work to transform data into information and information into insights that save lives, save money, and solve problems. Informs more than 10,000 members are comprised of a diverse and robust community of practitioners, researchers, educators, and students from a variety of fields. And their work literally touches every sector and has been responsible for life-changing and life-saving solutions driven by modeling and data. At the end of last year, we hosted our first webinar in the series, which focused on how supply chains failed and how to solve these issues moving forward, and some insights into what the policy community can expect in the year ahead. If you didn't see it, you can find that webinar on the Informs YouTube channel. Today, we're more specifically going to look at how supply chains are impacting our healthcare delivery systems, particularly within the context of the disruptions of supply chains within the pandemic response. I'm really delighted that today we are joined by two terrific Informs members and leading experts at the intersection of these areas. Tinglong Dai is a professor of operations management and business analytics at the Carey School of Business at Johns Hopkins University. And Sunderesh Heragu is a Regents professor and the head of the School of Industrial Engineering and Management at Oklahoma State University. So Sunderesh and Tinglong, thank you both so much for being here with us today. And let me begin with a question for both of you related to an issue that is very familiar to all of us. Now, we seem to be experiencing a shortage of COVID tests due to the Omicron variant. Wondering if you could talk about how did this happen, what needs to be done to ensure that testing is available going forward, and what else can policymakers do in this regard? And Sunderesh, I'll go ahead and start with you.
Thank you, Jeff. Happy to be here. To answer your question, I believe there are several factors that have contributed to the test shortage that we are facing. One of them has to do with holiday travel reaching almost pre-pandemic levels, and the pent-up demand amongst family and friends to get together. So the travel aspect has causing more people to want to get tested. Plus, starting last week, I guess classes have begun in schools and colleges, and that means more people need to get tested. So that again is putting pressure on the amount of tests that we have. Another factor is the Omicron virus, which, as you know, spreads very quickly, and people are, if they feel they are exposed or they hear that they've been exposed to someone, they are wanting to get tested. So with more people getting infected, I guess again that means more people are getting tested. The other thing that's happening, Jeff, is that elective surgeries now are beginning to come back to hospitals. I mean, people are beginning to resume elective surgeries. And as a matter of practice, hospitals, of course, do tests for every patient that comes in. And surprisingly, I think some places they are finding out that up to 2/3 of the people who come in for other reasons, in fact, have the virus. Last thing I will say on this aspect is that, the unvaccinated population is, again, because of the the Omicron virus is getting tested more often. I will just mention that, people are thinking that testing their way out of the pandemic is a cure. I think they'd be dead wrong. I think we need to do vaccination, masking, social distancing, practicing safe protocols and such to put a handle on this virus.
Great. Tinglong, how about any perspectives you'd like to share?
Thank you, Jeff, and thank you everyone for joining us. The way I look at this test shortage is that this is almost predictable if you think about the way the testing industry works. For example, if you think about the rapid test manufacturers, they look at this prediction about the case numbers. They're saying this is going to be a spike in cases because of Omicron, but then by February, by March, this curve will rapidly drop. So they see that's going to be that they foresee a drop in demand. So they get they make the decisions accordingly. It takes several months and millions of dollars, and not to mention you have the hire workers in the middle of this workers shortages. And to invest in capacity costs a lot of money, takes a lot of time. So it's almost predictable outcome if you do that kind of calculation, because demand uncertainty, I think, is a fundamental driver here. So like Sunderesh has mentioned here, is that right now we're in this demand spike, but 1 month, 2 months from now, probably a lot of people have already completely forgotten about this whole testing shortages. So we need to be able to provide manufacturers with kind of demand certainty through large procurement programs. This could be something similar to Operation Warp Speed, like what have we done for COVID vaccines. If we just imagine if we had done something like that for rapid tests, the situation would be way, way better, because from a government perspective, you could actually pool demand sources. You can reduce demand uncertainty because you're pulling demand from different places. Right now, if I need a rapid test, I try to search from Walgreens, from CVS, and from Amazon. There's just too much uncertainty for businesses to deal with. So I think the number one driver here, as I mentioned, is the demand uncertainty. And so we do have many ways of dealing with that, except that we're not really doing it. I think that's a fundamental driver behind the shortages we're seeing now.
Great. Well, thank you both. The shortages within the healthcare system were, I think, along with other shortages that consumers experienced, really helped elevate the issue of supply chains within the national discourse. Vaccines and ventilators and testing and PPE and a range of other products that we appear to have shortages on were real drivers. I think a lot of people, though, want to know, was this a result of the unpredictable pandemic, or were there underlying structural problems here that were really brought to light because of a pandemic? So Tinglong, let's start with you.
Sure. First of all, you're right. This pandemic was not predictable. It was not predicted, but I think somehow predictable because people knew there was going to be a pandemic. It's not if, it's about when. So there was going to be a pandemic. We have seen tons of writings in the literature 10 years ago, 20 years ago, saying that if there is going to be a pandemic, the United States does not have the capability to ramp up production in times of crisis. So this was predicted, and this was also realized. And so yes, the problem was unpredictable, but also predicted to a certain extent. Now, I like the second part of your question is that, are there any other structural problems? I think the number one, the elephant in the room is that we have an excessive dependence on foreign suppliers, many things. And but before talk about that, let me just talk about we do have success stories. It's not like we're entire failures. We do have success stories. Their success story is familiar to everyone else, which is COVID vaccines. If you look at one of many reasons, we didn't really have great shortages of COVID vaccine compared to many other countries developed and developing alike. One key reason is because we mostly rely on domestic manufacturing capacity, and we built up them, and we invested in them, and they're paying off, and not for this pandemic, but also down the road for future pandemics. Unfortunately, that's not the case for PPE and for surgical gowns, for a lot of other medical supplies. For the most part, we were dependent on China. If anything, through this pandemic, we are more dependent. So it's not getting worse. It's not getting better. It is actually getting worse. So you just imagine when you have a pandemic like this, or future public health crisis, it's not possible for us to ramp up capacity in a short period of time, because when the factories are gone, we don't have workers, we don't have experts, we don't have managers, and we don't have expertise, we don't have a technical know-how to build the capacity within a few weeks or within a few months. And so that's a fundamental structural problem we are facing now.
Great. Thank you. Sunderesh?
Yeah, I think my response is not too dissimilar to what Tinglong just mentioned. At the onset of the pandemic, we knew that we needed ventilators and PPE and all that, because this has been, I was part of, I led a large project back in 2009, exactly on this topic, which is response to, pandemic. At that time, we were thinking about H1N1, but then we knew that there'd be another virus sometime soon. So the playbook that we had then told us that we needed ventilators and PPE and other equipment, but what we could not anticipate was the actual number of people who were going to be hospitalized, and as a result, how many of these pieces of equipment we needed. But I think now we've got this under, well, to some extent under control. So certainly with the ventilators and PPE equipment. But I think in terms of structural problems, again, I go back to what Tinglong said, which is the over reliance on imported goods, not just medical devices, medical equipment, but also the things that people who work in the healthcare and the general population, right, that need, for their daily living, whether it's food, groceries, things that they would need to be working out of home. So this extended reliance on imported goods, I think that has got to change. We need to look at, critical products that we need, like I said, the medical devices, medical supplies, but also plastics, pharmaceuticals, chemicals. We need to be making more of those products inshore rather than importing from China or other places that are tens of thousands of miles away.
Great. So you've sort of spoken a little bit around my next question, but as we think about these supply chain issues, the focus has been on COVID and people's access to things that they need right now. But could you both talk a little bit about the broader impact to the healthcare system overall in terms of the risks posed by our supply chain issues? So Sunderesh, why don't I go right back to you?
Okay. Yeah, I think one of the vulnerabilities that we see in our healthcare system is, and I think in many other industries too, but let's just stay with the healthcare system. Certainly in the short term, is the shortage of healthcare workers. The strain that this virus and its variants have caused on doctors, nurses, at a time when they were dealing with patients dying or patients being sick, while at the same time in their own household, there were family and friends that were also either dying or being sick with the pandemic. That has put an enormous strain on healthcare workers. And, people are burned out. A record number of people are quitting the profession. So when you think about it, the impact of this stress strain on the healthcare workers, that's definitely going to lead to shortage. And I think that is our biggest vulnerability in the short term and possibly in the long term. And added to that, you've got a certain percentage of the population that is, irate. It's, illogical sometimes and motivated by what they see on social media. And so that has translated to more adverse effects on the healthcare professionals. Now, healthcare workers, more like, I guess, the general population, general workers, have gotten used to, this working out of home, a different paradigm, a different normal, if you will, and they are rethinking how, when, and where they want to return to work, right? So I think we need to, in the long term, the healthcare industry, but also, the general industry, I guess, needs to think about how they design the workplace, how they design the work, so that people's expectations, which is definitely going to change, if not in the next year, in the next 2 to 3 years, or even slightly longer than that, that's going to have an impact on people's expectations and how employers manage getting the service provided or the product produced. One last thing I'll add, Jeff, is that once this the hospitalization of this COVID-19 pandemic, if that begins to recede, you'll see more people visiting hospitals for surgeries and other medical procedures that they had postponed, that's when the long-term vulnerabilities kick in. And again, what I said earlier about being able to make more of the products at home, closer to the point of consumption. And this is not just the medical products, but Tinglong mentioned linen, but it's also the hospital beds, a lot of things that support the healthcare industry. We absolutely need to get back to producing them closer to the point of consumption, rather than rely on some long supply chain that has all kinds of uncertainties, not just at the factory level, but throughout the supply chain.
Great, thank you. Tinglong, any other thoughts in terms of the impacts or risks that supply chains pose to the healthcare system?
Well, I think this. You look at the risk, look at the fundamental vulnerabilities. I want to continue the point that Sunderesh just talked about, importance of having more domestic produced medical suppliers, because I think the issue is not so much about whether we have PPE, when we need a PPE, it has more to do a shortage of talents, shortage of engineers. We're saying the United States is not producing enough engineers. Like Sunderesh is an engineering professor, I'm a business school professor, but I gotta say the business schools are too successful, unfortunately, and we don't have enough engineers. And Informs is a great organization promoting decision science and also engineering techniques, but we don't have enough engineers. The reason we don't have enough engineers is because we don't have enough engineering jobs, and we don't have enough talents support this more domestic medical supply chain. So the consequence can be very severe. It means in the long term, we may lose the ability to innovate. If you think about the N95 masks, right? Everyone is talking about N95 masks today, actually, and from yesterday. It was invented only 25, 26 years ago in the United States by an Asian American engineering professor. So this is very recent innovation. Can United States continue to innovate at the forefront? And N95, we don't have to stop with N95. We can do anything better, a lot better, right? This is just one example. So the question is, can United States continue to be at the forefront of innovating the next like killer products? I mean, I do not mean that literally, but important innovations in the healthcare supply chain. So there's no guarantee, because in general, the engineers and they are close to where things are being manufactured. And if you will keep hollow out our manufacturing sector, eventually we will stop to innovate. So I think that's, to me, that's the biggest vulnerability we have to deal with. And the other thing is that we don't have a visibility into our healthcare supply chain, in the sense that we know we are very, very foreign dependent, but I think even more pathetically, we don't know how dependent we are, because we don't know exact capacity we have domestically versus from overseas. And we need to map our supply chain to have clear idea about where our vulnerabilities are. So I think the biggest vulnerability really is we don't even know where our vulnerabilities really are. We don't have the data.
Tinglong, that's a great way to lead into my next question, I think. So you and Sunderesh are both experts in operations research and analytics, and industrial engineering. So how can policymakers understand, how can the government and other interested stakeholders in this better leverage data science and math and OR and analytics to accomplish exactly what you were talking in terms of a better understanding of the supply chains, how we better understand how, when, where to manufacture and distribute those types of products and equipment, so that we reduce the type of risk that you both have identified. So Sunderesh, why don't I go over to you with that?
Okay. Yeah, a silver lining of the pandemic, if there is one, is the fact that we're going to have more disruptive innovation. And oftentimes, this disruptive innovation, we're talking companies like Uber and Airbnb and all that have contributed a lot to our society. So I'm talking about that kind of a disruptive innovation. Businesses have already begun, and they will need to continue to do this to adapt to the new realities that exist today and the new challenges or new realities that we are going to face in the next 1, 2, 3, even up to 5 years. So I already talked about the flexible work schedules, when and where, and how people want to work. But there's also other things. Tinglong mentioned the masks, right? Why can't we have, distributed manufacturing, 3D printing, and other technologies come to bear, to make what is needed, again, as I mentioned earlier, at the source of consumption. We talk about this N95, KN95, and another one that's manufactured in Korea. Again, even now, I think, these simple things like masks are being shipped from one place or a couple of places to the rest of the world. I think we could do a lot with these 3D printing and other technologies to make, I'm not talking about large parts, but maybe small parts that, we don't need to import them, but just make them where they're needed. But in addition to that, I think there's going to be a lot more automation, driverless technologies, whether it's in factories, in warehouses, or even on our roads. Right? All of those are going to present some unique challenges, but also opportunities. And I feel that we'll see a huge increase, and I believe Informs is positioned very well to take advantage of that. We will see a huge increase in logistics and distribution models, new ways of thinking about those problems, transportation and distribution, but also data science models, machine learning algorithms, artificial intelligence. When you couple the new paradigm, the new normal that we are going to get towards, along with the new technologies, the new business processes, innovation that's going to come our way, I can only think of Informs and people like Tinglong, myself, and thousands of others in the OR and industrial engineering communities contributing to algorithms, models and algorithms that you can use to solve complex problems very quickly. And I emphasize the quickness or the rapid, the fast aspect of developing these models and algorithms, because one thing we know for sure is things are constantly changing. And so a solution that you came up with in the early part of the day may be obsolete by the end of the day, or maybe even sooner than that. So how can we develop good, fast, reliable, and accurate algorithms and models to solve complex problems in an instant? And by that, I mean like in milliseconds. So we can apply that the next time the data changes, which may be in the next minute, the next hour, the next half hour, right? So I think that presents a huge opportunity for us, and the OR and industrial engineering communities are well positioned to address those challenges.
Thank you. Tinglong, anything to add?
Oh, I would like to expand on Sunderesh's point that Informs is a great community and with leading experts who can solve all the challenging problems. So this is really powerhouse if you're looking for someone to solve really challenging optimization problems and the inventory and resource allocation and the location analysis. Those are some of the core strengths. But also I think the new initiative being led by Jeff, but other Informs leaders here is to say that we are really scientists of decision making, and in the sense that we're not just good at solving problems, but we're also good at incorporating human factors and to look at psychology, behavioral insights, economic insights, connecting things together to make better decisions. So for example, we know for sure that the reason we don't have enough rapid COVID tests, not because we're foolish, we're stupid, we don't know how to solve the capacity problem, is actually the opposite. It's actually we're too good at optimizing manufacturing capacity, but just that the fundamental incentive structure wasn't set up in a way that encourage manufacturers to ramp up capacity. Not to mention, FDA didn't approve rapid tests rapidly enough to allow them to expand their capacity. So we actually have an incentive and a policy environment that isn't set up appropriately. But that's precisely the strength of Informs community in the sense that we know we are really good at machines, but we also really understand human behavior. So we know how to combine both sides to make better decisions. So for example, you think about demand forecasting and forecast demand for PPE, for COVID vaccines, for testing, or for prescription drugs. It's not just a matter of math or data science. It's a matter of understanding different players, incentives, understand what they are looking for. And so this is one way we could bring together both math and also behavioral science together to test different incentive programs, different policies. Like Sunderesh mentioned, we can do this on the fly, and when situation arises, and we can try many different things, and it doesn't take 2 years, 3 years to write a paper, demonstrate some causal effects, but instead we are able to support decision-making and in response to crisis. So I think COVID definitely have demonstrated that aspect.
Great, great. So I'm going to combine a couple questions that we had talked about before we came onto the webinar. So Congress and the administration are studying healthcare supply chains. They're looking at how to strengthen and make more resilient the domestic supply chains. I'm wondering, what would your advice be to those policymakers as they're thinking about this? But combining that from a long-term perspective, along with a short-term perspective, based on what you anticipate is going to happen over the course of the next year or so. So Tinglong, why don't we start with you?
I think that's great. That's actually the reason I'm here. I really want to share my thoughts about what we can do, how we can do better from here. I really think the number one here is that look, we're dealing with a free society and driven by capitalism, and the companies fundamentally they want to make money, and scientists they want to advance science, but they also need to be supported. Engineers as well, we need to produce more engineers. So I think first and foremost, we need to overspend, right? Overspend what we already have, overspend any other nations on earth on science and on research, on innovation. So if we triple the budget for NSF or NIH, that's still very little money compared to what we're spending in other things. So I would say we need to spend a lot of money. We need to make sure we are attracting the best and brightest from all over the world here. Make sure innovation we continue to have here, right? Because I think innovation is the most important part. If you think about healthcare supply chain, because we're not talking about producing the same N95 masks, the same prescription drug, the same vaccines for decades. It's not like that. This is all about innovation, all about competing for brains, competing for talents. But number two, more specifically to the healthcare supply chain, we really need to figure out our data visibility problem, because we don't have any, especially for equipment side, medical device side. For prescription drug side, we have limited visibility, but still not enough. We need to understand where things are being produced. And if we have a situation of crisis, we'll be able to access it. Doesn't mean we need to move everything back to the US. It could be, it just means a more balanced global supply chain network. It just means that we're not overly relying on China, one country. We have other supplies. It could be Mexico, it could be Europe, it could be domestic, but we have a more balanced supply chain network. So I think visibility is something we need to be able to improve upon. And if we have talents, we have visibility, we also need to have regularly conducted stress tests, like we have done that for banks. I do think we need to do stress tests also for healthcare supply chains, because the challenges we're facing is not just coronavirus. In the future, you can see that climate change could pose even bigger threat, not to mention other threats. What if there are wars? I mean, not just cold wars, there could be real wars. And there are a lot of things we do not even know yet, but we can do it. We have to be prepared. But if we don't know where we are, and if we don't have a people, talents, and to support we do, and then it's not going to help us too much. So yeah, so that's would be the three key policy recommendations I would have based on my own research.
Thank you, Tinglong. Sunderesh?
Yeah, I know we're bumping up against the clock, so I'll keep my remarks brief. 2 days ago, the Transportation Secretary Pete Buttigieg mentioned a lot of the short-term things that the government could be doing, and that I would definitely advise. I echo what he said about wanting the desire to unclog our ports, transport goods from ports and factories to point of consumption quickly. That requires changes in the transportation industry, maybe hiring more people at higher wages. So a lot of things can be done in the short term, and I think the government is addressing those. More could be done, relative to minimizing the bureaucracy for the production and distribution of essential goods. But I think what's not happening, but needs to happen today, is I'll list a few things, and Tinglong touched upon one of them, which is investment in R&D. That's critical because, like I said earlier, the only thing we know for sure is that things are going to change, right? That's a constant in all of this. So we need to be able to develop, test, and implement models that are not good just for today, but for the years to come. And we're able to adapt those models to meet the new challenges. But then heavy investment in critical infrastructure is extremely important. We talked about making key materials and supplies and end products here at home. Working with businesses to ramp up new technology development and innovation is another. More automation, I think that's going to help. I talked about driverless technologies, but there are other kinds of automation that would be helpful as well. One key point I'll make in terms of a recommendation is, diversifying the sources of energy production. We are quite a bit, even now, I think, reliant on oil and gas. And one of the problems with that is that the price of a barrel of oil fluctuates anywhere from $30 to $100 in a span of a few months. And that has ripple effects on the economy, not just in terms of gas prices going up, but also the product price for products goes up and down. And so one way to kind of avoid that is to have more energy production using renewable sources at home, so that we're not reliant on the fluctuations in the oil and gas market. And by the way, that's also very helpful and for the environment, and it's a sustainable thing. So that's in terms of what uncertainties we are going to face in the near future. I think it has to do with again the virus itself. I hope that we don't have another strand that is more virulent than Delta or more spreading than the Omicron virus. But like I said earlier, I actually did work about 12 years ago on a DHS funded project on this very topic, where we vaccinated 19,000 people in real life in 1.5 days. There's other things in the playbook that many people have done over the past several years. I think we need to bring those back and see how we can modify and adapt them for new challenges that we are facing. One other, I guess, variability is that the labor force, right? At this point, I don't know exactly how it's going to shake out, but I think businesses and government need to be prepared for shortages in the labor market. I think Tinglong mentioned engineering graduates in the state of Oklahoma. We typically, every year, we have demand for 3,000 engineers, but all of the schools in Oklahoma produce only 1,500 or a little bit more than that. And I think we need to expand STEM outreach to the underrepresented and untapped populations, so that we can bring more engineers that are able to meet the jobs that exist today. So with that, I will pause.
Great. Well, Sunderesh and Tinglong, thank you both for a really interesting and informative discussion. I appreciate your time and your insights. For those of you watching, particularly those working on Capitol Hill or in a federal agency or in the press, if you're interested in speaking further with Tinglong or Sunderesh or other Informs experts, please feel free to reach out to me at jeff.cohen@informs.org. Lastly, I'd hope that you'll take some time to join us for our final webinar in this series, which will happen on March 2nd. At the intersection of food insecurity and supply chains, promises to be a great and important conversation. That'll be March 2nd at 11 a.m. Eastern Standard Time. Again, Tinglong, Sunderesh, thank you for your time. Thank you to our audience, and enjoy the rest of your day, and Happy New Year to everybody. Thank you.
Thank you for the opportunity.
Very well.